Working as a dentist is very different than dental school.
Hi, you guys. Welcome to this video. I have my co-resident here, Dr. Jabber, Dr. Shatha Jabber. We met here in Pennsylvania doing our GPR, and she's a really cool person. She came here from Canada. She was nice enough to want to do a video/podcast interview with me. So we're gonna talk, have some conversations, and see where this takes us. I'm gonna have her introduce herself, but first she went to dental school in Canada. I do want to talk about that because there are some differences about Canadian dental schools and US dental schools.
Okay, so yeah, like Erica said, my name is Shatha. I moved here at the end of June to start my GPR, and Erica and I are in the same program, I think, like she said. I went to the Schulich School of Medicine and Dentistry at the University of Western Ontario, for those of you who are familiar, and I really liked my dental school experience, specifically like my classmates in my class. Eric and I were talking about this. I only had 56 people in my class. You had
144, which is a big difference.
That's crazy. That's almost the entire count of every year of my dental school. But I loved having a small class. Everyone was super close, and we had a very social class. Like, people would do a lot of fun activities and fun things, and it just made a ton of really, really, really lifelong friends, essentially. So I loved that aspect of dental school, but I'm sure, as all of you guys know, dental school can be really intense and difficult. It's a big, obviously, time and life commitment. So I think I also had the similar stresses, or like everybody else who undergoes dental school, and I definitely found that for me, especially at the beginning, it was a very steep learning curve. But I would say by fourth year, it was smooth sailing, I would say.
Yeah. So how did you get into dentistry? I know we recorded this a couple times, and I think the way she got into dentistry is cool, interesting, kind of funny, how you just fall into it. Everyone falls into dentistry in a different way. So yeah, how did you get into dentistry? You mentioned earlier, we didn't get it in the video, but you did a fifth year. I also did a fifth year. How did you get into dentistry, and how was that process?
I feel like I definitely have a very interesting path for how I became a dentist. So I honestly never thought I would be a dentist, and I remember when I was writing my apps, my apps to dental school, that was my first line of every personal statement. I never thought I'd be a dentist, ever. It was really funny how I ended up doing this, but essentially I went into undergrad thinking I would go into medicine, and all I wanted to be since I was a kid, I was I want to be a pediatrician. And the school where I went to undergrad, we had a children's hospital, so I was working in this lab and somehow got this opportunity to shadow a pediatric specialist. I think she specialized in orthopedics or something like that. So I got to shadow her a few times a week, and I did not like it. And I just couldn't imagine doing it for the rest of my life. It wasn't as hands-on as I expected. I don't know, I'm a very social person, and I like interpersonal interactions, and for me it just seemed she was such a great person to shadow and very nice, but it just seemed like she was so busy, honestly, hopping from room to room to room, barely any time to talk to anybody, and I don't know, I was just okay, this is not what I imagined it would be. So then I was you know what, maybe I don't want to be a pediatrician, maybe I want to be something else. So I started looking at different medical specialties, and thought I'd wanted to be a dermatologist because I love skincare and makeup, and of course dermatology is so much broader than that, but with my limited knowledge at the time, that's what I was hey, I want to do that. So I started looking into it, and I was realized it was super competitive, and I was this is crazy. It's also extremely competitive to get into any sort of professional school in Canada, just because whether it's dentistry or law or medicine, we just don't have as many schools or programs. Mm-hmm. I feel in the States, and it is of course very competitive in the States, but in Canada it's you have that, the fact that it's competitive with what your GPA needs to be and extracurriculars and whatever, and on top of that we just don't have that many programs, so it just makes it all that much more competitive to get into.
It's the same for dermatology?
In
Or is
Canada?
this just dentistry that's competitive?
Like, honestly, everything. Dentistry's competitive, I would say. Law is very competitive. Medicine's very competitive. Yeah, and I don't know the exact number of dental schools we have in Canada, so don't quote me on this, but I want to say it's around like 10 or 12. I'm not entirely sure. But, not that many schools.
Here it's like way over, I think, 60.
Yeah, which is crazy.
I think.
Yeah, it's insane. Like, I know 2 people personally who ended up doing dental school in the States who are Canadian, and I know many, many, many people do that. They either, go to the States or Australia or Ireland just because there are not that many spots for the number of people who want to do it. But yeah, anyways, I started looking into different medical specialties, and I was like, oh, this is so crazy. I'm already, grinding so hard in undergrad, trying to get the grades I need to get into medicine or dental school or whatever. I can't imagine getting into medical school and, having that pressure of having to be the top of my class or whatever. I really wanted, like, when I got into professional school, to focus on the learning and, like, being a good provider. And, I didn't want something in the back of my mind that was like, hey, you constantly have to be worrying about, a grade, which I feel like professional school, your grades don't necessarily reflect whether or not you're good at what you're doing, at least in my opinion. I was like, what, I don't think like medicine's for me. And then I was completely lost, honestly. Like, I was like, maybe I'll go into research. I did a ton of lab work. It's like, maybe I'll like get my PhD. And then I was like, no, not for me. And then I was like, maybe I'll get my MBA and go into business. And I was like, I don't know, I'm just such a people's person. It didn't seem like the right kind of field for me. And my best friend, who's also currently in her last year of dental school, was like, what, I really think you should look into dentistry. I think it'd be a good fit for you, all that stuff. And I don't know, I looked into it and I was like, this seems really cool. It has aspects of medicine. It's very creative, very hands-on, which is very much me. And I was like, what, let me apply. This was like in my 5th year of undergrad.
Wait, so for US, you have to apply to dental schools a year before. Was it the same for you guys? Like, I had to apply a year before and then interview the next year.
Okay, so I think you guys have rolling admission, correct?
Yeah.
We don't have rolling admission for anything in Canada. Every program has a deadline, and then you just have to submit your stuff by the deadline. Everyone's applications get reviewed at the same time, and they kind of pick whatever their top choice is to interview. So I think our interview cycle is later than what it is in the States. I think I remember I was submitting my applications during Christmas break. So I was submitting my apps in December for the cycle starting that September.
Okay, mine was in June, and then I got an acceptance December. So that's interesting.
Oh, wow.
So by December, I already knew where I was going.
Oh my God. Okay, yeah, that's crazy. I was like literally applying in December. I mean, you can apply earlier, but I just did mine very last minute. But I don't recommend that you do that, but whatever. That's how it happened for me.
Yeah, it happens differently for everyone.
I remember I was interviewing early April, I think end of March, early April.
Oh, wow.
And then I think we found out in May whether or not, you got accepted or not. So pretty late in my last year of undergrad, I was like, okay, F it. Like, I'm just going to write the DAT. And this is so bad. I studied for the DAT in 2 weeks. And it was in the middle of my semester, like my first semester of my last year. I had midterms and all the stuff going on, and it was crazy. Like, I didn't sleep essentially for 2 weeks and just crammed studying for the DAT.
Did you have guidance from your friend? Did she tell you like what to do, like what the DAT is, like this is what you do? Okay.
Oh yeah, like that was, thank goodness, because she had all the resources already, and she was studying for it too. And we were also like, we lived in the same apartment, so it was insane. Like, I just remember we had this dinner table, we'd just have like all these books out. We both bought this resource called Boot Camp, I think.
DAT Boot Camp?
I think so. Is it? Yeah, I think it was
I use that. There's another one called DAT Booster.
Or Crusher. I think it was called DAT Crusher.
Okay, I don't think...
I can't remember.
I'm not going to say we don't have that, but it's not a well-known one.
Oh yeah,
here.
I think the one we used was supposed to be like more tailored to like the Canadian DAT. Also, there's a Canadian DAT, and I think the difference is we don't have a math section. Do you guys have a math section? Yeah, we don't have a math section. Like the Canadian DAT was just a bio section, a chem section, PAT, and reading. That was it.
Okay.
And then the carving section was optional.
How does that work? Is that in person?
The
We
carving?
don't have a carving thing.
Oh, okay. So essentially, I didn't do it, but essentially, I think they give you like a bar of soap, and then they give you a paper with like a certain design on it. Or
Wait,
like
so you go into your testing center,
Yes.
and they bring you a bar of soap.
Yeah, like a bar of something, wax soap. I don't know. People always say to like practice on soap because I guess the material resembles soap.
And then someone watches you, or you do it like on a video.
No, like someone watches you. You sit on a table with like a bar of soap, and they give you all these carving instruments, and you have to carve. Like they give you a picture of something you need to carve, and then you have to carve it.
Okay, yeah, we definitely didn't have that. I'm trying to picture that because our tests were at a Prometric center. I don't know if you have Prometric.
We do. Yeah.
So there's like a screen, and the test is online, and then everyone is quiet, and everyone's taking different exams wearing headphones. So I'm trying to picture someone bringing the bar of soap.
Oh no, okay,
doing
so
this.
the Canadian DAT, so they usually did it at university campuses.
Okay.
And I think, actually I shouldn't say that. I think it's administered by the Canadian Dental Association. I could be very wrong. But ours was on paper. I think they changed it or in the process of making it all, computer based. But you get booklets and a Scantron and you do the whole thing.
interesting.
Yeah, like you do it in a big lecture hall. And everyone who comes in is writing the DAT. They offer it a couple times a year. I don't think they offer it. It's not like
All
you
the
can.
time.
Yeah, it's not like you can go in like any month or any time. Like it's only I think 2 times a year or something like that. I could be very wrong again. I can't remember. And again, this all happened in the span of like 2 to 3 weeks, so it was just all a blur.
So when did you find out how you did? Do you find out right away? How long do you have to wait?
I want to say a month. We had to wait a bit. I think 6 weeks or
Find out
something.
right away. The score pops up on your screen.
Oh
so
my
you know how
God.
you did like right away.
That would have been nice. Let me tell you guys, I was stressing out because I don't know how. For me, Pat was the hardest section. I can't remember what I would struggle with some of the sections a lot. So I did my undergrad biochemistry. So the bio stuff and the chem stuff, I was like, you know what? I had a good foundation. So I distinctly remember, also because I did it so last minute, the only testing center I found was in Ottawa, Ontario. And for reference, Ottawa, Ontario is a 6-hour drive from like where I lived at the time. And that was the only place that was left. So I essentially booked my test in Ottawa. I had booked a hotel. I went with my mom, I remember, and I was like, hey, someone has to drive me because I was like, I'm going to be studying on the car ride over. Like I have no time to waste essentially. And I remember I had like a midterm or a quiz on the Friday. The exam was on Saturday. I had a midterm on the Thursday, and then I wrote that midterm, got on a bus to go to my parents' house, got in the car with my mom Thursday night, and we just like drove straight to Ottawa. And then Friday I had like the day to like sit at the hotel, whatever, relax, and then Saturday wrote the exam. So that 6-hour drive up to Ottawa, I remember having this like packet, like bundle of papers that was supposed to be a biology review, and I just like crammed that entire like booklet on that 6-hour car ride, and that was essentially how I studied for bio. Do not recommend.
How'd you feel after taking the exam? Did you feel like, oh, I killed it, or like that was a mistake?
I definitely was like, oh, that was a mistake. I wish I practiced more. 2 weeks was not enough. I'm not gonna lie, like bio and chem, especially bio, I felt really good about. I didn't feel like I saw anything that I didn't know. Those I felt very, very good about. I feel like reading, you can't really tell how you did.
Yeah.
At least for me, it's just
until you see your score.
Until you see your score, and that was fine. And like Pat, I remember feeling like really short on time. Like I think I got to the last page and I was like, like I have 2 minutes. So I just like very quickly tried to like get through as much as I could get through. But honestly, like it ended up being fine. My Pat score was like on the lower end, but it was average. And then my bio and chem scores were pretty good. So overall, everything averaged out to be
Pretty good.
Pretty good. And I think that was lucky. Like, I would certainly not recommend that anyone do this.
So on average, how long do people usually study?
So for example, I think I wrote it in November. No, did I write it in November? I have no idea. I can't remember. I think November. And I think people start studying in the summer. Like, people start studying in July, August. Like, people spend a few months at least studying for it. I was just stupid and, like, didn't know what I wanted to do. so it just ended up being so last minute. And I remember as well, I was putting my application together and I applied without knowing what my DAT score was. So it was like a shot in the dark. And I ended up only applying to one school. Like, I ended up only applying to one school, like, which is my school, got an interview and got in. Don't know how that happened. Like, honestly, like, everything just felt like a stroke of luck. And I don't know if anyone out there believes in that. I really do believe in things that are, you know, sometimes if something's meant to be, it just works out if you, like, put in the effort. And I just felt like, okay, this is probably, like, meant to be. Everything just worked out very, very easily. But yeah, that's how I got into dentistry, and then I got in and, you know, started dental school, and now I'm here.
Yeah, wow. That's a long, well, actually, it's a very short journey of getting in. You did it all very quickly. So it seems like you tried out a bunch of different career paths, and then you're like, this is what I want to do.
Yeah.
This makes most sense. This worked out. So now how do you feel about dentistry now, being in a GPR, practicing dentistry as a dentist? Do you feel it's what you thought it would be? Like, is it everything you expected? Are there things you didn't know about dentistry that now you're finding out? For me, I didn't really know how, like, a dental office worked. Like, I didn't know I would have to do hygiene checks. I didn't know I would have to be, like, treatment planning, like, super fast, doing all these checks. I didn't realize how busy
Like,
life
how
of a
fast-paced.
yeah. It's kind of too fast paced for me at points. Do you feel like you made the right decision? How are those thoughts going?
So I feel like it's kind of a loaded question. Like, did I make the right decision? I feel like now, I feel like yes. Did I always feel like, yeah, I made the right decision? No. Like, I know during dental school, I definitely would question whether or not I wanted to do this, especially in second and third year. I was like, I feel like a lot of my friends had that too, where it's like, I don't know if this is, like, necessarily for me, or this isn't what I expected. I will say this, working as a dentist is very different than dental school, and I don't know if you would agree with that.
Yeah, I think it's definitely very different. There's some things that are harder and some things that are nicer, like having assistants and having hygienists do your cleanings is nicer, but it's a different type of stress.
Yeah.
And I don't know if it's going to get better, like, as I get faster, if it will get better. I don't know. I'm still new at this.
Yeah, I feel like I completely agree with I think overall, definitely better than dental school. I only really see it getting better. I don't see it getting worse, because right now I feel like the challenges right now, like Erica was saying, is getting faster, which is one of the reasons I'm so glad I'm doing a GPR, and I think honestly we're lucky in the GPR program that we have, because we have really great attendings, and I don't know, I feel like I'm very supported by the attendings, and I feel like, you know, if I'm running behind or something's taking too long, you know, they don't really add pressure. They're kind of just like, hey, like, you're here to learn, and, you know, they're very supportive from that end. It's also better in the sense that I think dentistry is good because, honestly, like, compared to a lot of other medical things in the medical field, once I get home from the clinic, I'm done. Like, I don't need to round on anybody. I don't have to worry about getting called in the middle of the night. I mean, we have on call, but most dentists...
I feel like that's a different experience than I'm having, because when I get home, I'm writing notes until, like, 9 p.m., but I should stop doing that.
Yeah, no, so I get that. It could totally be like that, but I feel like that's also factoring in the fact that we're still very new at this and, like, slower. I kind of gave myself a rule where it's like, when I go home, I try I'll stay a little bit longer to finish my notes, but, like, when I'm home, I don't want to be doing that. And it's true, like, you could go home and, like, need to look up charts or, like, look at patients and do that kind of stuff, say like you're a dentist and you've been practicing for 10 years and now you're so much faster at like writing notes and doing the administrative stuff. Once you're home, you're done. Very rarely are you going to get called in for emergencies. Even if you get called in for emergency, no one's dying. Like no one, it's not like it's a life or death sort of a situation, which is great. You have a lot of free time, flexibility. It pays really well for, especially for the lifestyle you get to have. And I think as well, like as challenging as some things in dentistry are, eventually, for most things, you do eventually get the hang of things if you practice enough. Overall, I think it's really great. Right now, am I at that stage? No. I feel like right now I'm still trying to get faster, learning a bunch of different things that I, didn't learn in dental school or didn't necessarily know how to do in dental school. But I feel like, hopefully the goal is by the end of this year is I'm a little bit closer to, being faster and more proficient and like knowing how to do more things and having that lifestyle that I want.
Yeah, and it's crazy if you go into medical school, every medical student has to do a residency program. We do rotations at our GPR, and I did a rotation in the emergency department. Shotha's doing one right now. They no matter what, they have to do a residency, and the residencies are either like 3 to 4 years. I think they could be longer, but they're working like long hours, like over 40 hours a week, and getting paid very little for that time. So in dentistry, you don't have to do that. Ours is just 1 year. You can choose to go into a specialty if you realize general dentistry isn't for you. So that's the nice part about it. I've kind of realized I don't want to do root canals. If I'm a general dentist, I'm gonna refer those. You can pick and choose what you want to do, and then if you want to specialize in something, you can just do that. So there's a lot of options for dentistry, which is my favorite part about it.
Yeah, no, it's very flexible, very, very flexible. And like Erica said, like as opposed to dental school, like if there's something you're like, I effing hate doing this, like I'm not very good at it, it stresses me out, you don't have to do it, and that's great. Like you don't ever have to worry about doing things you don't want to do. One thing I think that's worth mentioning, and I think you touched upon it too, is practice management and the business side of dentistry. I mean, first and foremost, of course, you're like a healthcare provider, but you're also managing a practice, and that, I mean, at least for us, didn't really get taught in dental school, and that's a huge portion of being a successful dentist.
Do you want to have your own practice, or have you thought about it much?
I mean, I don't know. I feel like...
You don't have to know right now.
I don't. I honestly, like right now, I'm just trying to get through this GPR, and like realistically, I'm probably going to be like an associate for a couple of years before I, even think about having my own practice. Yeah, that comes with a lot of administrative stuff, like a lot. So that's also something to think about if this is a field you want to do. I think for specialists it's a little bit different, because as a specialist you don't necessarily, a lot of specialists do have their own practices, but a lot that I know also don't, and just rotate through different practices and just offer their specialist services at a different practice, for example, every day of the week or whatever. And that way you don't have to worry about, okay, I have to have my own practice. And yeah,
I haven't thought about that too much. Did you always know you wanted to do a GPR, or did you feel unprepared towards the end of dental school that made you want to do a GPR, or was GPR like something that most of the dental students at your school did, that it was just like the norm?
Yeah.
Or why did you go into GPR? And also, do they have general practice residency programs in Canada?
Yeah,
okay.
They do.
Because you came pretty far.
Yeah. So lots of really good questions. So I feel like from earlier on, like I would say maybe about second year of dental school, I knew that I would most likely do a GPR. A lot of people from my school do GPRs, and it's something, honestly, a lot of the faculty at my school really encouraged. A lot of the professors we had that I really liked was like, wow, like you're a phenomenal like clinician, would be like, oh, I did like a GPR. I wouldn't say a lot. Okay, so I would say in my class, like definitely a lot of people went straight into practice, but we had quite a few of us also do GPR, so it's pretty common as well. For me, there were things that I was like, okay, like I didn't get the most experience doing these procedures in dental school, like one of them being surgical extractions, for example, and I knew I just wanted more experience with that. I also kind of like the idea of just having a year where somebody else is like teaching you different things, different ways of doing things, which I'm finding so far has been very beneficial. When I was looking at GPR programs, I really wanted to do a GPR, but I think I was more concerned with finding the right GPR, and I had like a list of things I was looking for in a program, and I had the mindset of, you know what, if I don't find programs that fit this criteria, I'm just going to go straight into practice, because I don't want to waste a year of my life not learning what I want to be learning. So right off the bat, Canadian GPRs are good in the sense that you're working in big hospitals, you're seeing a lot, but for a lot of the programs, I think the on-call schedule is really hectic. At least from what I've seen, I haven't found like a program they're very, very, very hospital based. The GPR program at my school, for example, was very surgery heavy, very cancer heavy. You're doing a lot of like oral cancer follow-ups and things like that. But for example, they didn't do a bunch of restorative and they didn't do endo. Any of those cases got referred to our dental school or like a different practitioner. So I was looking for GPRs that had everything. Like they did everything, because ultimately my goal was to get faster at doing everything and also try to figure out, okay, like what do I like, what do I not like what is my day-to-day practice going to look like. And I'll be honest, like even when I was looking through programs in the States, there are really good programs and they're also really like
Not good programs.
It's very important to have a list of what you want and what you're looking for and ask those questions when you're interviewing or when you're applying. For me, this program that I'm at was my top choice, and I liked them because they did everything. They even did ortho, which no other program that I looked at did ortho. That for me was like, that's awesome. I'm getting an experience that I would never get anywhere else. It's worth it for me to move out. It's only a year, and I feel like I would be getting a lot out of it, so which I feel like I am, so I'm very grateful for that. Obviously, the only downside is you're certainly not making nearly as much money as you would be if you went like straight into general practice.
What's the biggest thing it has taught you? For me, it's taught me that I don't want to do certain things.
Yeah.
And that I know I want to do ortho, and also that I'm not ready to open up my own practice. I feel like when I was in dental school, I don't know why I felt ready. Seeing how a practice runs now, I don't know what I was thinking. There's no way I would have been ready.
So I feel like there are a bunch of things that I learned clinically that I, didn't learn in dental school. Honestly, by my first month of my GPR, I feel like I've finished my grad requirements for dental school maybe 3 times over, if not more, for certain things. My first day in my GPR, I did, maybe like a third of the surface requirements for operative that I did in dental. Like I had a day full of operatives and I was like, wow, like that's like a third of my graduation requirements in a day. You learn a lot. You learn a lot because you see a lot and you do a lot. I feel like, to be completely honest, like the clinical things I'm learning are extremely valuable. But I would say equally as valuable are non-clinical or like soft skills, I guess, that I'm learning. One of the biggest ones is, I guess I started thinking about like what culture or what sort of staff, or like, I don't want to use the word vibe, but it really is like vibe, and do I want in my practice? Or even if it's not my own practice, like what kind of a work culture would I be looking for in anywhere I end up practicing, even as an associate, because I feel like the types of people that you work with can like really set you up for success or really do the opposite.
Yeah. So I definitely learned a lot about people also.
Yeah.
And like in a sense, it's made me want to be my own boss eventually sooner, because you can have full autonomy of like who to hire and what kind of vibe you want, I guess, in the office. Mm-hmm. I've learned a lot about people, and how to talk to people. I feel like I'm coming off one way, but people can receive it a different way. You learn a lot of people skills as well.
Yeah, no, for sure. And like, you hit the nail on the head. Like, that's exactly what it is. Like, it's just, you learn a lot about how to work with different personality types. People have different work philosophies, different priorities at work. You know, it's not like anyone's like better than another, like good or bad, nothing like that. It's just people are different, and you need to understand that like you're the main healthcare provider, like you're leading a team in a lot of these situations, and you need to get very comfortable working with different personalities. And sometimes you have personalities that, you know, your personality might clash somebody else's personality, but like you need to find a way to work around that. And I feel like ultimately as a dentist, like that's your job to figure out how to do that. I think that is the biggest lesson. The clinical skills are also huge, but for me, that definitely is the biggest lesson.
About the future, we'll wrap this up with what do we see for the future. What I see for my future, I want to do ortho. Hopefully that is what my future holds. And eventually I want to have my own practice. Where I'm going to be located, I don't know yet, but it's probably going to be the U.S., somewhere in the U.S. Do you know what the future holds for you, or what you envision your life to be in like 10 years, 5 years, where you hope to be, or maybe even next year? And if you don't know, it's fine as well.
I don't. I honestly don't, which is crazy because this is so not like me.
Are you a planner?
I'm a planner for sure. I really don't know. And I feel like, honestly, like for me, I'm trying to really force myself to soak in this year and to really try to figure out what it is I want to do. I might not want to do general practice, and I'm just trying to figure out what it is I like. I don't know if that was loud in the background. Sorry. Yeah, sorry. I don't know if you guys could hear the background noise. But essentially, I'm just trying to take this year to figure out what it is I like and what it is that I don't like. And I think maybe by like December, January, maybe February, I'll have like a clearer idea of like where I want to go from here. I don't know for sure yet. I'm like, if I want to continue doing general practice, maybe I'm going to want to specialize, maybe I'm going to want to go back to Canada. Like, I don't know. And I haven't really decided yet.
Yeah. But that's really good to know, because it's good to know that not everyone knows what they want to do, because I'm sure the majority doesn't know what they want to do, and then they think they're supposed to know, and then they're lost. I'm sure so many other people don't know, and they're like, wow, I feel better. I'm not the only one that doesn't know, you know.
And you know what? It's also good to think about it this way. Like, it's better to take your time to figure out what it is you actually want to do than like rushing into something without fully knowing. Like, that's kind of how I'm thinking about it. I'm really okay with not knowing. I feel like I'm more focused on making the correct decision, I guess, than a fast one. Yeah. And you know what, guys? Most people, when they graduate, of course it's different, but you're really young. There really is no rush to know right off the bat what it is you want to do. You already like have a great career ahead of you. You have job security. Like, you'll find a job no matter where you go. And that's huge. Not everybody has that. You know, even if you don't know, you still have a lot going for you.
Yeah.
In my opinion. So
it seems like Shatha is recommending dentistry.
Yes, I would definitely recommend it. And, you know,
even with how much it costs, would you still recommend it?
I have a very strong opinion about this topic. So in Canada, it costs less, I think, than what it does in the States. Like, as a reference, I paid every year in dental school just for tuition, like not including like housing, food, none of that. Mm-hmm. Tuition for us cost roughly 60,000 Canadian dollars a year. About $45,000 a year for dental school. For undergrad, it was about 10,000 Canadian dollars a year, which I think is 7,600
that one's
USD.
A big difference, I think.
Yeah, so our undergrad costs significantly less than it does for American people. I still have like a considerable amount of student loans. I just don't think it's nearly as much as like an American student would have. With that being said, I would still recommend it, even if you are racking on a lot of debt. The only thing I will say is it matters where you go to dental school.
Oh, interesting.
It really does. Because if you are spending all that money on your education, you better make sure that you're getting a good education. Like, you better make sure that once you leave dental school, you'll actually be proficient at doing the things you need to be doing. Not every dental school is a good dental school. And that's something I kind of realized, I think, from meeting different people. So I would really I think where you go to dental school really matters.
Interesting. So I've been thinking about this. After graduating, I graduated from one of the most expensive dental schools. I had a great experience. I feel like I learned enough to be a good basic dentist that isn't going to kill anyone or extract the wrong tooth. So I feel like I know the basics, but it was really expensive. So I haven't figured out if it was worth the money yet. I had a great experience. I was happy. I learned what I needed to learn. So right now I think it was worth the money, but the thing is I can't compare it to a different dental school because that's the only experience I had. I don't know what it would have been like if I went to a different dental school and had a different learning experience. One thing that I did learn is choosing a dental school can affect residency if you want to go into residency, because my school didn't have a class rank. Didn't give you a class rank. I don't know if your school gave you class ranks.
Class ranks, yeah.
So I learned from applying to residency programs, they look at your class rank, and sometimes if you don't have a class rank, they won't look at your application at all, is what I heard personally from one school, which was a surprise to me, because then if you don't have a class rank, how can you even apply to that residency program? Or you can apply, but how will you get in? So that's something to keep in mind. If you know you want to specialize, you should probably go to a school that gives you a class rank and gives you a GPA, in my opinion. I had a GPA, didn't have a class rank, and had a good non-competitive experience. I didn't feel like I was competing against my classmates. I have a different friend at a different school, and I don't know if she feels like she's competing against her classmates, but if I knew what rank I was compared to everyone else, I feel like the dynamic would be different. So that's something to consider. Those are my only thoughts about it.
Yeah, I think adding to that point is when you're looking at dental schools, the quality of education is very important. Like, you want to be asking, the upper years, I guess, what their experience is like in clinic. Do they have enough patients? Do they do a lot of different procedures? You want to ask those questions. The other thing is class culture, I think, is extremely important. I feel like even if there is a class rank, it doesn't necessarily have to be competitive, and that largely depends on the school culture.
Right, because you guys had class rank and you had a great experience.
Yeah, honestly, people would share resources all the
Okay, so my card memory is full, so we're going to wrap this up. But thank you so much, Shatha, for sharing your experiences and your thoughts, letting me pick your brain about dental school and about GPR.
So Thank you for having me.
Thanks. Bye, guys.